Hi, I'm Dr. Ramsey Choucair, a board-certified plastic surgeon with over 20 years of experience in facial rejuvenation. Today, we're going to address the question that often comes up in a consultation is, what are the limitations of modern facial rejuvenation? In other words, what problems have we not solved yet that would make a difference if you have surgery? Certain aspects of facial aging remain difficult to fully correct. And the most common one, and the one we deal with the most, is the loss of skin elasticity. Even the best facelifts can't fully restore the lost elasticity. So skin loses its elasticity with aging. It thins, and then the collagen volume in the face and in the skin, the production diminishes. And then the surface becomes less hydrated, less plump. Skin cells don't turn over as often, which makes the skin not look as healthy. And it leads to and creates crepe-like appearance to the skin, which manifests itself in wrinkles, pigment changes, and of course, there's the dull skin and the appearance of less hydration, and that dewy look, that smooth, youthful glow tends to go away. That's all because of the loss of elasticity in addition to other things. So what can be done about that? Well, skincare treatments will certainly temporarily improve those things and reverse it as much as possible. We don't have the greatest answers with skincare to reverse the elasticity. We can camouflage it. Surgically, we only have a single alternative, which is really to redrape or lift the skin. You must be doing that in a very gentle, natural way. You cannot overpull or tighten the skin beyond what it should be, or you start having a look that's abnormal. Many patients will often ask why we just didn't pull the skin tighter when the elasticity relaxes, like in the neck, but that doesn't solve the problem. The elasticity loss always wins. The skin will relax to some degree, and putting more tension to the skin is not the answer. This is especially true with loss of elasticity in the central and lower neck, where the skin can just simply not be pulled as tight because the incisions are usually behind the ear, they're hidden. And the further away from the incisions, the more the skin relaxes further away. And of course, you want to make sure you don't create an abnormal appearance. The second thing we don't have a great answer for is muscle relaxation. This is primarily in the muscle bands or the platysma muscle, which many times will relax, and it's difficult to improve on a long-term basis. We certainly know what to do in the neck to improve the bands, but keeping them from coming back is the problem. Because in youth, those muscles are stuck to the deep tissue and are very firmly attached. As we get older, those attachments relax and the muscle pulls away, creating the bands. And at some point, the muscles pull away and you simply can't just retighten them. They'll just simply relax. So that's one of the areas that is also elusive in our armamentarium to treat neck aging. In thin individuals, these bands are even more prominent because there's no fat covering the neck. So in thin patients with tiny muscle bands, we try just to make sure that patients understand the reality. And platysmal muscle banding in thin individuals, no matter what you do, will likely recur to some degree. And it's only intellectually honest to make sure patients know that ahead of time so they're not disappointed. We don't know how to put those natural, youthful attachments back in the muscle to push it where it was when we were young. So muscle laxity and neck bands and sagging muscle are challenging to correct permanently. We just try to make sure when we do correct them, they don't create an abnormal look. These problems we can't fix with the muscle persist because the deeper structures, the anatomical structures, are difficult to reestablish like we were in our youth. For example, you can tighten skin and lift muscle, but you can't fully replace those structural supports. And that's of course why we do the deep plane or the SMAS lift, to try and make sure we do everything we can to lift those muscles. While we may not have solved every challenge in facial rejuvenation, we continue to push the boundaries of what's possible. If you're considering a facelift, know that the results we can achieve today are better than ever. Thank you for watching.